Thank you, ma'am. Thank you, sir. Please seat. Now I'd like to welcome our organizing chairman, Dr.
For sharing his knowledge and insight with us today. Thank you once again to all. Thank you very much.
Thank you, sir. Thank you for your speech. Presence in events will always make it memorable. Now, I'd like to invite our principal, sir, to present a bouquet to our academic dean, Dr. Balagurunathan, sir. Let's all give up a clap for them. Let's honor our academic dean, Dr. Balagurunathan. Let's honor our dean, ma'am, Dr. Jayalakshmi, ma'am. Now let's honor our academic dean, Dr. Balagurunathan, sir. I'd like to invite Dr. Shembhavali, ma'am, to honor Pami Sinha, ma'am. Now let's honor our nursing principal, Dr. Raj Lakshmi, ma'am. Now I'd like to invite Dr. Satyaraj, sir, to honor Dr. Somasundaram, sir, principal of AHS.
Medical students, this is one of the memorable day in which the Bachelor of Physiotherapy department is conducting a wonderful CME on pain therapy. Pain is the one which will be very acute in nature and intolerable. And everyone, whenever you go and consult a doctor, the first question they will ask, is there any pain? Even if you show the swelling, redness, inflammation, edema, they will not bother. They will ask one question, acute pain. Acute pain signifies lot of reasons. Pain, pressure in the nerve, and then there is some blocking of the artery, claudication, or there are different types of pain which will be intermittent. Even the myocardial infarction is having a characteristic pain, and then the peptic ulcer pain, and everything acute, the pus abscess pain, throbbing pain, and then intermittent claudication pain, all those things. There are so many types of pain. Pain itself is one of the huge chapter. Its intensity, and then the frequency, how much of duration it persists, everything is one of the most important symptoms. The physiotherapy department is dealing with such one of the wonderful topic, and today they are going to conduct workshop and they have arranged a CMB. So the guest speaker has come and he is going to elaborately discuss with you all the aspects of pain, and you will be able to thoroughly understand. At the end of the day, you will come out with all your objectives satisfied. So on this wonderful occasion, I congratulate the physiotherapy department for conducting such a workshop, and I thank the management, our chairman sir, Dr. Jagat Rachagan and Sandeep Anand for having given this opportunity to conduct, and I thank the Almighty for making everything a possible one. So with these few words, I wish you to go into the program and go into depth and get yourself immersed. So wishing you all the best of luck. Thank you.
Thank you, ma'am, for kind words. I'd like to welcome our anatomy department HOD, Dr. Vijisha ma'am, in this occasion. Now, I'd like to invite a sharp-witted person, our academic dean, Dr. Balagurunathan sir, to share his thoughts.
First national workshop for 24 from the Department of Physiotherapy. And to begin with, I think, let me thank our chairman, Dr. Jagat and our president, Mr. Sandeep Anand, for allowing us to keep conducting quite a lot of CMEs around in this building. And our beloved dean, let me welcome our beloved dean and our vice principal and our controller of examination and nursing college principal and your college principal. Yes, and our very distinguished guest speaker from Bangalore, Dr. Kumar. I welcome you with all my heart, please. And apart from that, from Manakula, I have Dr. Bhaskaran and Dr. Murali. Satish from PIMS. More than that, I think the host department people, even though we have been hosting the function, I should welcome you all again. And the second thing, I welcome our HODs from anatomy department, Dr. Vijisha, and Dr. Professor Aparna, Professor Rajini, and from our nursing college, from the physiotherapy department, and our Dr. Berman Professor, plus our FM Professor, plus all of them from the physiotherapy department. So today the topic of the day is the pain management. Yeah, I think it is becoming a day-to-day problem perhaps. That's true. Maybe it wasn't that bad, I would say 50 years back, inside the hospital premises. I don't think we have been disturbing the physio people so much. Nearly 40, 50 years back, I think we allowed you people, all of them to be in peace. But nowadays, that's not the way. So regarding the pain management, as far as the hospital is concerned, the Department of Anesthesia has taken over part of it, as far as the pathological aspects of the disease. Whereas with the musculoskeletal disorders, especially we physio, always we have been standing at as a backbone or the back of the orthopedic department. Always. Whenever they cannot, always they send the patient back. If the patient has been coming for a few weeks, trying to annoy the department saying that, what the hell is going on? Come on, my pain is still not over, something like refer to physio. At least another 2-3 weeks, you can get it off, and then by the time you can afford to make up your mind what you're going to try to the patient. So this was true with the so-called orthopedic problems. When the traumatology came in now, with every other person falling on the road, breaking the bones, right from 10 to 80, people, they don't spare anybody. In fact, to say elderly people must be scared to walk on the road nowadays. The so-called two-wheeler fellows, they don't allow anybody. See this, you must make a note of it. Poor people, nobody could walk. Even you and I cannot walk safely. Eh? Any two-wheeler comes with the so-called, the whatever the modern machines who have been screaming through. We are in trouble. So, traumatology has taken so much of a part, and in fact, to say, I think pain management from the orthopedic department has become a real issue. As far as the bone is concerned, it's a mathematical solution. 1 plus 1 is always 2 in bones. Whereas with a muscular problem and with a tendinous problem, you won't even be able to exactly assess, cannot even guess, or you cannot even label it. But still the patient is symptomatic enough with the pain. And that's the headache of the physiotherapy department. No doubt about it. So, with the traumatology assuming so much of a problem, people being hit on the roads, it's not the bone alone which breaks. When the bone breaks, so many other things do happen. So, naturally, I think we the physiotherapists, I think we are at the rescue of the public. That's the truth. I'm telling you. So, no doubt about it, I think you are becoming so important enough. That is the truth. I'm telling you, don't take it for granted. Unless otherwise you know the anatomy of each and every part of the body. Exactly what are the muscles, where are the origin, where is the insertion, where has it been plucked out, and how exactly you need to put it back or something like all these things. So you need to know, your 4 years course is worthy enough for an absolute knowledge of the human anatomy and physiology and pathology. I think we are taking classes for you, for all that. I think we have arranged. That's right. So, the Department of Physiotherapy is, I would say, it's almost absolutely important enough as far as the hospital is concerned, and especially the pain management from your own senior person will always give you a very good, deep knowledge of your future clinical practice. That's the most important thing. So make sure you grab in everything from him, how to manage the patients, especially when they come with such a critical, painful phenomenon, and learn the best out of him today and from this workshop. And I wish you all the best for this department, for this wonderful workshop. Thank you.
Thank you, sir, for your amazing words. Now, I'd like to invite our Vice Principal, Dr. Kami Sinha ma'am, to share some words.
Respected Dean Madam, respected Dean Academic Sir, Deputy Controller of Examination, Nursing Principal Ma'am, and our Chief Guest, Dr. Senthil Sir. Very good morning to one and all. And my dear students, so this is very important national workshop, this first national workshop on pain management. And I think physiotherapy has come up and grown up so much that I think day to day, every time, all the people, they need this physiotherapy. Most of the time, even after surgery, the physiotherapy has to be done, and you people are going to be very busy for this, for physiotherapy management. So this has come up very much, and I wish all the best and congratulations to Physiotherapy, College of Physiotherapy. Thank you.
Thank you, ma'am. Now, let's invite our forward-thinking person, Dr. Somasundram sir, Principal of AHS, to deliver a short speech.
Good morning to one and all. Respected dignitaries on the dais and off the dais, respected HODs of various departments, and my dear students, a very good morning to one and all. So actually this conference was planned very long back, but we had the opportunity just now under the guidance of our chairman and vice president and our CEO Anbu sir, students affairs officer Vishnu sir. So we had a lot of tough time to get this thing, but somehow we got it. And it is really a very interesting topic for us. So when it comes to pain, I think we just remember one term known as noxious, where the tissues are damaged. So when the nerves are, we can identify, but when it comes to the tissues, noxious. So in pharmacology, all of us learn about NSAIDs, opioids, general anesthesia, local anesthetics. But when it comes to certain where the therapeutic management stops within that, beyond that, I think the physiotherapy has to have a role. So you are in a very important place where tomorrow you will know the importance of this. I think the deteriorating of age for diabetes from 60s, now it's come to almost 30s. So the same way, once diabetes has come, I think this pain management has to come. We are going into neuropathy, all types of neuropathies. So this is going to be a very useful. I welcome the speakers, Senthil sir, and the other speakers from Manakula Vinayagar and PIMS to elaborately expand and give the information regarding this pain management, which is going to be the core for the next 4 years for these students. So I wish this School of Physiotherapy to go on the next level, to increase their knowledge by conducting more and more conferences. I thank the Principal Velmurugan sir for giving me this opportunity to attend this function. Thank you once again.
Thank you, sir, for your kind words. Now, let's invite our visionary thinker, Dr. Rajalakshmi ma'am, Principal of Nursing, to give some words.
Present good morning to the respected dignitaries on the dais and off the dais, and my dear students. So, at the outset, I congratulate the Department of Physiotherapy for organizing such a beautiful workshop, which is need of the hour, the pain. So, whichever the systemic disorder that starts with, either it may be the cardiac, we start with pain, musculoskeletal, we start with pain, gastrointestinal, we start with pain, or sometimes reproductive start with abdominal pain and so on. Even renal system start with cramps and so on. So it is considered as a need of the hour, and it is a beautiful topic, even though there are various managements are there, pharmacological and non-pharmacological management to deal with the pain. The pharmacological management at the outset causes various side effects, and we can't be for the prolonged time with the pharmacological therapies to deal with pain. So on the other side here, there are a lot of other alternative therapies are there that deals with the pain and its management, and it is such a beautiful topic, and I welcome the resource speaker from Bangalore, Dr. Senthil Kumar sir, and I request all the delegates to make utilize of the resources and share and grab the knowledge from him and make utilize in your day-to-day practice, and I wish all the very best for all the participants of today's workshop. Thank you very much, sir.
Thank you, ma'am, for your kind words. Crafting timeless celebrations, timeless memories. Now, I would like to invite our principal to honor our dean, Dr. Jayalakshmi ma'am, with a momentum. Now, our principal will honor our academic dean, Dr. Balagurunadan sir, with the momentum. Now, our principal will honor our guest speaker, Dr. Sendil P. Kumar, with a momentum. Now, our assistant professor, Dr. Shenpagavalli ma'am, will honor our nursing principal, Dr. Rajalakshmi ma'am, with a momentum. Now, it's time to honor our vice principal, Dr. Kami Singh ma'am. Now, our assistant professor, Dr. Shenpagavalli ma'am, will honor our AHS principal, Dr. Somasundaram sir.
Thank you, sir. Thank you. Please be seated. Now let's step away for a short tea break and come back refreshed. We'll convene in 10 minutes.
To a stimulating and informative session. Welcome, sir.
Tomorrow I don't know where it will be. Yes or no? Sometimes you feel that, sometimes you feel the other probability. Okay, so everything is possible. What I want you to focus is the psychological component here. Okay, the first and foremost feeling. And the definition of pain itself is unpleasant sensory or emotional experience. So unpleasant, whatever you are not happy. Pleasing means, pleasant means happy. Okay? Unpleasant means I am not much happy about this. Okay? I had only tea, I didn't have the coffee. So I am not happy. Okay? I will have my own reasons. So same way, I am just citing an example. Okay? Unpleasant sensory. Sensory, what is a sensory? In his body, he lifts the arm like this. No, sit down. He lifts the arm like this. All of you lift your arm. The right arm. Lift your right arm. Okay? Hello, hi everyone. Okay? Until I tell you, don't lower the arm. If you don't lift your arm, trust me, after 1 month something will happen so that your arm will never go up. No, faculty, no problem. Just relax. But students, when you are lifting the hand, what makes you that unpleasant feeling? Is it really pains? Whoever pains, lower the arm. Whoever is getting the pain, put the arm down. யாருக்கெல்லாம் கை வலிக்கிற மாதிரி ஒரு ஃபீலிங்கா இருக்கோ, அன்பிளசன்ட்டா ஃபீலிங்கா இருக்கோ, கையை கீழே போட்டுருங்க. Okay? Still you are able to hold. So some people have got the unpleasantness faster. Some people didn't get the unpleasantness now also. Some of you are doing like this. Some of you are, whoever is keeping the arm like this, lower down, where elbow is bent. Because you keep the elbow straight, more you will feel uncomfortable. Correct? Do you feel that muscle activity is more when you lift the arm? And also, do you feel your hand is cold? Cold. Whoever is feeling the hand and fingers are cold, lower the arm. Because this is blood vessel, blood circulation, arterial circulation. Arterial circulation is less, so you are feeling the cold sensation. Okay? We have two participants. Even him also, he lowered the arm. So only, what is your name?
Preeti, sir.
Okay. Preeti.
Yes, sir.
What is her full name?
Preeti.
See? Everyone knows your full name also. Okay? So, no. Give a big round of applause to Preeti. Okay? It's not about physical performance. Sit. Okay. Stand. Okay. Any of you had difficulty in sit to stand? No. Okay. Do you have difficulty in prolonged standing? Some people have that. Okay, so you'll feel like, let me sit. Yes? So everyone, sit down. So that means some of you have difficulty with sitting, some of you may have difficulty with standing, some of you may have difficulty with squatting, and some of you may have difficulty with sit to stand or stand to sit or stair climbing. What I am trying to tell is knee pain is the same. Every patient may have knee pain. If you treat knee pain, you are treating all the patient as same. But if you ask the question whether stair climbing is painful, whether sit to stand is painful, whether squatting is painful, whether standing is painful, then you are treating the standing, you are treating the squatting, you are treating the sit to stand, you are treating the patient rather than treating the pain. To differentiate, what is treatment for knee pain? That is theory. But when you see functional treatment, we have to treat what is difficult for the patient. What made her to take the treatment? Means, I might have neck pain, but I will not go for treatment. But when I am not able to ride the bike, when I am not able to write, when I am not able to text, when I am not able to watch a movie, then I will go for treatment. It means that functional limitation will make the patient to go for treatment. So treat the functional limitation. In your mind you recreated the thumb pain. Okay? By thinking about the pain. For example, some of you, your parents would have had the pain in childhood. When you are a child, the parents would have had neck pain, back pain. You would have seen grandma having pain, not moving around. Very rarely. Or maybe in childhood itself you had a fall, you had an accident. Okay? Then what happens is the brain's plasticity, the cortical plasticity will be preferentially active to pain. So even a little pain comes, if I touch or I hit him, he'll be, ah. You would have seen people. You will tell, I just tap. You just tap your friend. But he will say, ah, please. Have you seen, many of you? Okay? Some people are like, you tap them hard, they'll be like, ah, yes, what? But the other people, you just gently tap, they'll tell, ah, yes or no? So that is, the brain is sensitive to the pain. Brain is sensitive to the pain. Okay? Childhood they would have got. There are two types of options. For example, he's already got it. If you say this boy, what is your name? Okay. So, get up. Imagine that he is wearing a new shirt. What is he having? New shirt. So what I do is, what am I doing? Pinching. Okay? New pinch. Okay? He will be like, why are you doing the new pinch? Correct or not? Yes or no? So, means, do you think hand is the cause for hand pain? Is hand the cause for hand pain? No. Hand is not there also, hand pain can come. Okay? That means the last organ which is not there, we will not feel the pain, is the brain. If brain not there, you cannot feel the pain. Understood? So this is not psychological, this is biological, but created by the brain. How? You have neck pain 3 years. After that back pain starts 6 months. Then knee pain starts 2 weeks. Repeated exposure to pain in life makes the person to become, brain to be neuroplasticity towards pain, preference towards pain. The best example of when during the inauguration ceremony, when the nursing principal, madam stood, all the nursing students clapped. Correct or not? That's a, if that person standing there means all these are activated. It's same like the areas of the brain. Physiotherapy principal, immediately physiotherapy. And also, when they mentioned that Manakula Vinayagar College and they mentioned sir's name, everybody clapped immediately. Manakula Vinayagar College of Physiotherapy. Okay? So, and whenever, in any of the film functions, movie functions, you always see, when we say Talaivar, there's a group of people who will be clapping and whistling. But when you say Talabadi, everybody will clap. Okay? Because nowadays Talabadi is also Talaivar. Okay? But what I am trying to tell here is the preferential activation is there. Different areas of the brain gets activated in response to what we like. Okay, what we think it is important, our brain works for it. And what happens here is pain is important, that has come. And on your right hand or your right leg, which part of the brain controls? Left side of the brain, right? And then left side of the body, right side of the brain. Agreed? And there is a sensory cortex and motor cortex. In the cerebral cortex, we have sensory cortex and motor cortex. In this, there is functional mapping of every region of the body. We have hand, we have leg, we have eyes, we have lips, everything that is mapped in different parts of the brain, which is called as, what is the word? Starts with H. Hemisphere is anatomical. What I am trying to tell is physiological. Functional mapping of the human body in the brain. H. Hypothalamus is a relay center. It's a primitive brain. H-O. H-O. H-O-M. Sensory and motor. So that itself, representation of the brain. Homung. What is that? HOM? Oh no. Homeostasis is a body's balance, okay, internal regulation and body balance. I'm expecting a better word, which the answer came from there. Yeah. What is that word? Homunculus. Sensory homunculus, motor homunculus. Homunculus outside the scope of a biological model, but psychological methods should also be known. And remember that it is also part of our multidisciplinary framework. We do have a psychology course. We have MSc psychology here. No, okay. But you see that psychologists will be coming and taking lectures for physiotherapy. They'll take nursing, psychiatric nursing. There's a specialty itself is there. So remember that nausea, plastic pain, non-organic pain. Both are types of central pain. Okay, central means brain related, and brain related could be structural or functional or psychological or physiological. Right? Till here, have you understood? Did you get some idea about the types of pain? The central pain. We have not come to the peripheral pain. Peripheral pain. We'll give a short break. Okay, before that, I want the central pain to be understood more. Okay, you should identify people so that you can effectively treat psychologically or treat the brain. Don't treat shoulder. Shoulder pain is there, but the shoulder pain is produced by brain. So when you treat the brain, the shoulder pain will disappear. Example of such method is, have you heard of mirror therapy? Mirror therapy. The painful hand is hidden behind a mirror. Normal hand reflection. My left hand is normal, my right is affected, it's painful. This folder. Imagine that this is a mirror. Hold it like this. So this is a mirror, okay, this fluorescent folder, okay, and this is the reflecting side. So what I can do, this is my painful hand, I can hide it, and after that I can keep the normal hand. So I do the normal hands movement in the mirror. What I will be seeing? My right hand movements. Right hand is not moving, but the brain is trained to feel that right hand is moving when the patient looks into the mirror. During the left hand movements. Okay? And that makes the person to get better, and the other side which is hidden will start moving. Okay? When the patient is just watching the mirror, but you will see that affected hand also will be moving behind the mirror. Because the moment you feel that my hand is moving, my hand is normal, the hand becomes normal. Same as how thumb is paining, it starts paining. If you are thinking that, do I have headache? Left side, okay? Immediately you will start getting the headache. Not because of my lecture. Okay? So what happens is because of the brain, the mind. Mind is a psychological component. Brain is an anatomical representative, okay, of the intellect. What we learn from our life. I want you to touch the floor. Bending forward and touch the floor. Stand down, stand down. Come this way. Come this way. Come fully. Spread. Have space. Stand in front also, back also. I want all of you to experience that flexibility When you bend forward, bend forward. Okay, he's able to touch the floor. What's your name? Huh? Rahul. Rahul bend forward, bend forward. Come to the front. Come to the front. Please come to the front. Come here. More. Everyone. What did we do now? What did we do now? In the sitting. Sitting, what did we do now? Neck flexion, knee flexion, neck extension, knee extension. This is not for muscles. This is for nerve. This is for nerve. Which nerve? The dura mater. You have the three meninges. Outermost layer is dura mater. Innermost layer is pia mater. And the intermediate layer is arachnoid membrane. Okay? Oh, great. Give a big round of applause. Okay? So, what we actually treated, this is a dura mater technique. Okay? It is called as the slump test. Slump test. But we use it in a modification. What is the actual slump test? Both knees extended and the neck flexion. With hands also behind the back. It is almost like this. Okay? So that is the full component of the test. Slump test. But we don't have to do this. But we used it as a treatment. What did we do? When the stretch is there in the leg, extend the neck. Now stretch not there in the leg. Correct? But when he bends the neck, the stretch comes back in the leg. Neck movement causing stretch in the leg. It's not hamstring. Hamstring is not attached to the neck. Any physio is thinking that hamstring is attached to the neck?
No, sir.
So then what is attached to the neck is the dura mater. And the dura mater through the sciatic nerve. And that's what modifying that neck movements are modifying the stretch here in the leg. Even if I put him with the legs up, okay, straight sitting, you feel the stretch? No. Make the foot up, okay, now stretch is there. So he did ankle dorsiflexion and is getting stretch in the calf muscle area, correct? All of you, even you can do this. Come volunteer and come forwards. Sit on the plinth, long sitting. Move into dorsiflexion. Feel the stretch in the calf. Come. Those who did not get the improvement, the bending forward, you didn't get much improvement. The two who have improved, yes. Other two didn't improve, na? You come here. Long sitting. Supported. Okay? Legs are on the plinth only. So you can sit like facing each other. If two people have to sit in the plinth means. You sit like this, she sits like this. Like RAC train tickets. Okay? Sit and put the legs here. Another two more. Train ticket RAC தெரியாதா? RAC sitting confirmation எப்படி உட்கார்ந்து போவீங்க? அப்படியே தூங்குவீங்கல்ல அதே மாதிரி உட்கார்ந்து. So just sit opposite and facing each other. Do the dorsiflexion of ankle. You get a stretch in the calf. Yes? Yes? வருதா இல்லையா? ஏன் வருத்தமா இருக்கீங்க? That stretch, extend the neck. Now no stretch. Okay? Now if you bend the neck, the stretch again comes in the calf muscle. Ask them, yes or no? Correct? So now what you are going to do is, foot down, head down. Foot up, neck up. Head up, foot up, head down, foot down. Head up, feet up. Okay? Head down, feet down. This is totally, there is no stretch. Okay? It must be easy for you to perform. Yes? Now come back again down and try touching the floor. Come back down. Yeah. Touch the floor. Okay? Okay, still having the restriction. Okay? Okay? Not bad. Okay, oh, she is improved, definitely. Give a big round of applause. The most important fact here is, when you treat the nerve, the muscle flexibility will improve.